Uganda is a beautiful country located in Eastern Africa with a population of around 30 million people, and it's growing really fast considering in 2014 the population was 34 million. The youth account for 78% of the population, and it's not just in Uganda but generally in globally, like the youth are, there's more youth in developing countries according to research. Life expectancy is 58 years old, and the rest of the information is there. I specifically picked this because we've had a lot of issues in Uganda, and the main problem I think we are facing is HIV and AIDS, like in most countries, but in Uganda specifically, I chose these countries because we are having issues related to HIV and AIDS. And you can see in the 1960s, the life expectancy was really low because I think that's the time when AIDS was really killing a lot of people, and the general life was really low, and so people were really not healthy. But as you can see, in 2010, we've gone high. If you compare with Botswana, Botswana is really facing a lot of health challenges, and Uganda has done a lot of improvement in regard to health improvement. Okay, so these are the main health challenges we are facing: alcoholism, conflict-related factors, early marriages. Most of these factors are actually poverty-related because we have a lot of unemployment. We have early marriages is a result of unemployment because everyone wants, you need a source of income if you don't have a job. So most girls are married off probably at 12 or 11 because, parents want something, they need money coming in. And then conflicts, we've all heard of Kony, I think, most of you. And we are having also refugees like from Rwanda because of the genocide. So we have a lot of people from neighboring countries because they come looking for shelter and stuff like that. And then traditions and customs and unemployment, like that is a general issue. We have a lot of unemployment. So most of the youth are poor because they don't have jobs, and as a result we've had a lot of brain drain because most people are traveling to the developed countries looking for better jobs and greener pastures. Then I'm going to go to the political side. Uganda is a centralized, uses a centralized system of government. We have a lot of gender inequality. Law enforcement is very poor, and quality of care is very poor. And most stigma is a result of, like I said, HIV. No one wants to associate with these people, and it's like, well, there's been improvement, but I think the rates are still high. Like, we really need to do a lot when it comes to HIV and AIDS. So quality of care is really poor. We don't have doctors, we don't have, we are lacking a lot of medical personnel. Human resource is really low. And so, well, when you mention infrastructure, there are a lot of hospitals, but there's no doctors to treat the patients. Then I basically put this to show where we are in terms of willingness. Like, we want to change, but we don't have the capacity to change. So we are strong, we have strong willingness, but the capacity is very weak. Why? Because we lack funding as a country. So what do the youth want? We all want better health services, we need funding, we need empowerment and independence to authority. Like I said, there's a centralized system of authority, so all power comes from the president because he controls everything. So it's hard to make certain changes in a country where you're not allowed, you're not given the freedom to express yourself. Then, well, this is basically how some of the developments that are happening, technology and SNS, social media has played a very big role in informing people, information awareness, and trying to educate people on the different diseases and how to keep safe in terms of HIV and all those other STIs, other infections. And we all know, like, we learn a lot from home. So the government is trying to encourage parents, talk to your kids, because you don't really learn so much as you grow up. You need to start from home, and that is what is happening. And yeah, so with that, we have had trainings and community empowerment. We've had access to, okay, if these are some of the things that are happening, but I think with better improvements and better enforcement and participation of the youth and the community, we will have some of these quality treatments. And the youth are really playing a big role, especially in terms of technology. One of the problems we are facing is, how do you change people's mindset? Because most people are traditional, like they have traditional mindsets. So it's hard to tell someone, you need to change from this kind of life and, move to this kind of life, because people have their own thinking. So anyway, these are some of the things that are happening or that will happen as more the youth get involved. And I wanted to show one of the success stories. Okay, so this is basically some of the, I work in an institution called Makerere University. It's a public institution in Uganda. So I work in the College of Computing and Information Technology. So students come up with these projects. There's no internet connection, so I have to just explain. Students come up with projects that, help to improve some of like this part is basically infant mortality, especially in the rural areas where people don't access health services. So students come up with these nice, good projects that are being implemented because they are being used in these small clinics and small hospitals to help patients, easy access and quality treatment, and they are really working and helping families improve their quality of life. Thank you.
Thank you very much. I'm really sorry, but we don't really have any time, so we are going to only have one question. So can you choose a person to that?
Sure.
Thank you, Lily, for a good presentation. You mentioned that there's willingness, but there is no capacity to change. And I think one of the key things that you've highlighted is that you don't have enough doctors. Now, is it the duration that it takes them to study that deviates them from studying and becoming medical practitioners, or is it the benefits that they're given as a result of being doctors? What is it that discourages people to enter into that field?
Medical field? or people going to the medical field, the problem is they find better opportunities in developed countries or in other countries, and they have to go because it's better. Life is better out of Uganda. So yeah, that's why. Thank you.